So
Thank
there
you.
is two objectives. One is the briefing of the upcoming PMNCH board meeting. And I know that you have asked me and the Secretariat if we can provide this to go through the board agenda, the objectives, and also the background document. So I will do that in this seminar. The other, which we then have given you a more lengthy presentation and recording of, is the presentation of the 2022 and 23 progress report. And then the highlight the outcomes and achievements, as well as what the board will then discuss, and all the committees and working groups have discussed today, is the priorities for PMNCH in our next biennium budget, which is the last one in our strategy period. So without then further ado, let us then go to the agenda for the board, and we will then go through there. Please, PMNCH members and colleagues, feel free to use the chat to introduce yourself there, and so that we can then get to increasingly know each other. So the board, the next EC meeting is next week, and thereafter it is the board meeting on the 27th and 28th. It is virtual, and it is, as you can see, half day from noon to 3 p.m. CET. And the objectives of the board meeting are very much to go through a number of strategic issues, and you will then recall that the board decided that their mandate was of strategic purpose, taking care of issues pertinent to women, children, adolescents. Second is to position PMNCH in order to drive change and for women, children, adolescent health. And three is to oversee the executive committee's work. So here is the mandate, and we will, Dina will scroll down. And I will jump this page because the objectives come again under each agenda item. So on the 27th, we'll have agenda item 1, which is then the notes for the record, as well as the approval of the agenda, and also the conflict of interest issues. So quickly, we will go to agenda item 2. And here is the first strategic issue at hand, and that is evidence for action, a pathway to better health in 2050. And here the objective is to discuss emerging economic and financing evidence on the benefits of investing in women, children, adolescent health, and how it can guide evidence-informed policy making. So the expected outcome here is to agree on framing and use of evidence for PMNCH's advocacy efforts in 24-25, including in relation to a potential World Health Assembly resolution on women, children, and adolescent health in 2024, as well as engaging with regional and global financing platforms. Would like to just share with you that the commission, the Lancet Commission for Investing in Health, has got together again and is being updated or re-energized with Larry Summers and also with Dean Jamerson as co-chairs. And there is also efforts by the World Bank to develop the DCP4, which is the Disease Control Priorities 4, and this report and work has extensive work on one, updates to the DCT and implementation of DCP 3 recommendations, 2 COVID, that's the second volume, and the third is on investing issues in health, and 3 and 4 is the UHC interventions And we have then been in dialogue with the organizers and coordinators of these reports, because this will come out of the bank and be a critical recommendation, not only for the bank, but for countries and all, to make sure that these are aligned, that all of our efforts feed into that, not the least the adolescent well-being investment case, and also all of this work here. So this agenda item will have two presentations. No, that's too fast. One is on the 50 times 50 content, costs and mortality reduction consequences of achieving the grand convergence, which will then be provided by Professor Gavin Yami. He is a member of the Lancet Commission, but he is also co-chair together with Mark Hansen on the work stream of economic and financing, where a number of you are also members. The second presentation will be an overview of the adolescent well-being investment case, which will then be given by Donald Bundy, and it will be the effort that the Victoria University have done in this. This will then, we will then have comments on how can investment evidence be leveraged during political advocacy opportunities in 2024. And here we have tried to get different angles. One is the private sector from the World Economic Forum, and also looking a little at how this can be. And as you know, and we have got Charlotte Albrell here, who has been chairing, co-chair of the investment case for the work that WEF has been very busy in for the last 2 years. The second here is the Commission on Status of Women, Commission on Population and Development on ICPD, and how this can, these economic cases and the arguments, economic arguments, can be strengthened in taking better to heart the ICPD targets and recommendations. Next, we will have, and now you must scroll down, please. Here we will have then Bruce Aylward, who's the Assistant Director General at WHO for UHL, and to then see how we can use this kind of evidence to actually make the case for resolution for women, children, adolescent health at the WHO. We'll also then have Chris Carter saying a little bit about the value of these this type of analysis to influencing platforms like the G7. We have also reached out to ministers, both of gender as well as health and others, to also understand from them how useful this piece of this type of advocacy and piece of evidence is useful in their internal negotiations of budgets in government. So that is actually, and Mark Hansen, who is the chair of the working group, but the co-chair of the economic and financing work stream together with Gavin, will then have closing remarks. What we have prepared here, or what we have for you here as background documents, is the concept note for the Lancet Commission on Investing in Health, number 3. And we also have the adolescent in a changing world, the case, the investment case. So that is, we hope, is good background documents for you to empower yourself for the discussion of this first strategic topic at the board. Let me move on to the next strategic topic, and that is keeping the pressure up, increasing commitments for adolescent well-being. And you will recall, dear partners, that at the last board meeting, the board asked the EC and the Secretariat and also the committees to update the board on the results of the Global Forum for Adolescents, which is this our partners forum, and the topic. And although it was different in style, it was intentionally. It was the year of the partners forum, and so we will here review progress achieved with the Global Forum for Adolescents 11-12 and agree on priorities for mobilizing more and greater commitments for action in line with the Agenda for Action for Adolescents and targeting the September 2024 Summit of the Future. So here is expected outcome is to agree on 2024-25 action plan for adolescent well-being. And Helen will chair this session. We will have two key presentations. One, it will be provided by our one of the vice chair under 30, Aditi, on the report from the Global Forum for Adolescents, but it will also include an update on the 1.8 billion campaign, which continues. And then there will be a presentation on the action plan for adolescent well-being for 2024-25, which David Imbago will give, who is then the chair of the AY constituency. And Naveen Tucker will also be part of that. The comments on the action plan will then be provided, and we could then maybe scroll down here. There will be opportunities for engaging with global and regional political platforms. And here, Ambassador Espinosa, who many of you remember from the 19th of September event in New York, where there was a number of commitments, government commitments pledged, and also pledged from other platforms, EU, as well as non-governmental commitments. Then we will get a commitment, adolescent well-being commitment implementation, catalytic role of the UN. And here it will be Anurita Baines from UNICEF who will speak on behalf of the UN in regards to the updates of the commitments as it relates and the work of the UN. Third is reflections from private sector constituency and opportunity for greater engagement and mobilizing adolescent well-being commitments. And here is the board member, Per Falk, who will then speak on behalf of the constituency. The discussion will be priorities, will feed into and culminate into priorities for implementing the Agenda for Action for Adolescents, and especially looking at 24-25 and the follow-up, the necessary for. So there is then two background documents here. One is on the proposed action plan for adolescent well-being in 2024 work plan, and then the next is the report on the Global Forum for Adolescents. So that is takes care of this second strategic agenda, and we shall now move to the third, and that is happening on the next day, and it is called the Agenda Item 5, strengthening support to regional political platforms to drive policy action. And I would like to remind you, dear partners, that we have in the past PEC, which is the Partner Engagement in Country Committee, has been occupied not only at country level, but also regional. And our political analysis of platforms have included global, regional, sub-regional, and also national. So per se, this the intent of this agenda item is to further that thinking, but also honing in this time on Africa. So the objective is to agree opportunities and priorities for strengthening PMNCH's support to regional political platforms and development and economic communities, and to regional parliaments to strengthen and advance their WCH policies and goals. So the expected outcome here is guidance for PMNCH efforts to strengthen three interrelated areas of work to leverage regional political platform. One, supporting the Global Leaders Network, and then two, further development of collective advocacy action plans in priority countries, and then three is the development of a regional advocacy plan. So here we will have, and we'll need to scroll down, Joy Pumapi, the chair of the of PEC, the Partners Engagement in Country Committee, to then invite remarks on opportunities and priorities for PMNCH support. And here we have then thought that it will be good to have the Commissioner for Health and Humanitarian Affairs and Social Development from African Union, and in that perspective. The other is, I would like to say, is our own Mohammed Pateh. He gets new hats, as many of us do, but here he will sit not only as Minister of Health, but very much ECOWAS chair, and then speak to how one can actually use this platform as to drive change. We'll then also have Buddy Shah, who is the CEO of the Clinton Health Access Initiative. And the reason and his angle will be that, as you know, Chai is a lead partner on several of the CAPs, and the CAPs are the Collective Advocacy Action Plan. So he will speak to that. Then last will be Minister Fala, who from South Africa, representing the chair of the Global Leaders Network. So that angle, how can we use at the highest level presidents and prime ministers to not only provide commitments in their own countries, but also influence a greater change across countries and across platforms. And then he will also reflect on the perspective of BRICS. So the discussion and what we have for you here as the background document, which is currently being has been reviewed by both PEC and SAC. You will remember PEC is the Partner Engagement in Country Committee, and SAC is the Strategic Advocacy Committee. So these have had a meeting, a joint meeting, and have then discussed these. We have a background document that we will then be also providing. I need to scroll down. We will also, as a background document, provide a slide deck that gives you an update of all of the collaborative advocacy action plans. And please, partners, you will remember that the board decided that there was going to be 10 in 2023. And the retreat earlier this year in February discussed potentially 30, but SAC and PEC have come with the recommendation that we should maybe limit ourselves to 15. So the suggestion is to add 5 more next year. And that those countries are Ethiopia, Mali, Niger, Ghana, and Indonesia. So, and you will then be provided with all of the countries in this update. Let me stop and move on here. This is the last strategic item, and it is one of importance because it influences the work plan and the investments, our energy, and also the investments next year. And the objective of this last agenda item is to reflecting on success and lessons learned during the implementation of PMNCH's 22-23 work plan and agree on PMNCH political advocacy priorities and implementation approach for 24-25. And this is the final year of our existing strategy. So this becomes then very important because this is when we have to make sure that the results in our results framework are obtained. So what we have for you here as background and background documents is the progress report, as well as the 2-pager on priority suggestions for 24-25 from PEC and SAC committees. Now, the expected outcome here for this session is approval of the PMNCH 2023-24 progress report and the guidance of developing the PMNCH 24-25 work plan, which is a two slides. And it has the key deliverables that have been suggested. The presentation here is, of course, our new EC chair, Mr. Pant, Government of India, as Secretary of Health, who will then provide very much a summary of the progress report for 22-23. And then we will have Kitinji Gitani to present on behalf of actually not only SAC, but all of the committees and working groups, suggestions to 24-25 priorities on our work plan. And that, I think, concludes the board agenda. Is that correct, Dina? Are we? Yeah?
Yes, it's correct, Helga.
Yes. So that is that. I would like to suggest, if you have any questions regarding the board agenda, that we take that now before we go into the summary, the agenda item 2 for this webinar. I will also spy the chat to see if you have posted any of the questions there, but please feel free to raise your hand, and then we can take the questions here. Okay, I don't see any hands and I don't see any questions, so I would just like to then suggest that we move on to the second agenda item of this pre-board webinar, and that is to give you a summary presentation of the 22-23 progress report. And so let us then take you through this. So the first main slide here is our results framework. And please, PMNCH members, remember that this has been approved by the board. And it is a little detailed here, but we do have, it is our theory of change, and it does, and our results framework is measurable. It is, it has numbers attached to it, but here is the path to from inputs, outputs, intermediate outcomes, and then to ones that we contribute to. And then we contribute to also high-level outcomes, and we contribute, our efforts contribute then to impact. So this is what we've been always using. And then the next slide is a detailed overview of our work plan. It's a 1-pager. It has 10 deliverables, which are organized, as you will remember, under our different aspects of advocacy, because the way that we have defined advocacy, powerful advocacy is to have knowledge synthesis that contributes to powerful advocacy. We have partner engagement that contributes to powerful advocacy, and we have campaigns and outreach. So, and then we, with your help and also the board's approval, identified 10 flagship products, which are detailed here in the rows. And so these were then articulated. And so you will find products in here that have been overseen by working groups and committees in PMNCH's governance. And so they have been budgeted, and also these working groups and and committees then oversee the production and also the accomplishment of the different events. So these three first ones have to do with knowledge products and accountability products. The second bulk has to do with partner engagement, which is defined as capacitating partners to do a better job in advocacy, but also strengthen platforms and networks so that our partners can do more together than alone. And under this bulk, 2.1 is about the Global Leaders Network, which is the highest level of advocacy at the highest level. 2.2 has to do with the CAPS, which is the Collaborative Advocacy Action Plan. It includes the parliamentarian engagement, and it includes also the regional efforts. The 2.3 is capacitating through webinars or other means, not the least the digital advocacy hubs. And then 2.4 is very much our governance work. The last bulk of the advocacy is campaigns and outreach, and that has to do with campaigns. And our biggest campaign, of course, is the Global Forum for Adolescents, 3.1, and 3.2 has to do with both events that we organize or we lead on, but also many that our partners lead on and would like support from PMNCH. And then the third is media outreach and digital and earned media products developed and disseminated to support advocacy efforts, including then accountability processes focused on commentary, blogs, podcasts, videos, interview statement, and all of our social media reach. So these you will now see are being budgeted. And you will recall that the board and EC approved a 10 million essential budget level per year. And you will also see we have estimated what the expected expenditure will be by the end of this year. So you will then see that for budget of 2022, we were at 9.89, and then at 2023, we're 11.9, so approximately 20, a little over 20 million. But then what we have used in 2022 and plus 2023 is together 19 million. So our implementation rate is 92% at this point, and we are then also have set aside 10 million for the next 2 years. So we are not fully funded for the next 2 years because that would be 20 million. So we are 50% funded at this point, and we need all of your help to do resource mobilization. Let me go to the next slide. And this is a popular slide because it is results by numbers. And you will see that the columns here are on knowledge synthesis, partner engagement, but in campaigns and outreach. And we have then tried to capture what we do in numbers, which feeds into our results framework. And as you can see, our numbers are increasing per year, not only a cumulative, but also the rates and our coverages and our reach is really expanding. And all of this is together to do quality follow-up of commitments, be it PMNCH, SRHR, or adolescent, as well as influence and help or coordinate 5 regional or global action plans. And in there are included the COVID call for action, but also the adolescent advocacy, adolescent agenda for action is 2 examples. Okay, so this is the kind of a snapshot. Let me move on because I want to just give you 1 page on the more in-depth results. We start with partner engagement because there is something about mobilizing ourselves for action and strengthening platforms and strengthening capacity of our partners. So what we have done here is really work with His Excellency President Ramaphosa of South Africa. And there we have been working with his team. And there has been, to date, positive responses from Senegal, Bangladesh, Denmark, Honduras, Tanzania, and France. There might be a change in structure a little bit more from being a more flexible structure than being a kind of a locked network. But we are looking at this moving forward. The second is ministerial engagement, and here there has been very much follow-up and dialogue through events, either regional or international. But the idea here is now to more follow up at country level, which was actually very successfully done by FIA and Plan and other partners. And we will hear more about that as alluded to at the board meeting. I do think that there is something that the CAPS, the Collective Advocacy Action Plan, needs to in some way provide a common product between all of our partners to unite around. There is also digital advocacy hubs that are being designed and implemented so that our partners can get better contact with each other and also better access to the same type of information. There is also then the parliamentarian engagement, and here we've been present at all 4 of the IPU assemblies and have had over 40 meetings, bilateral meetings with speakers and members of parliament. The grassroots engagement includes the CAPS, which you can hear very much more about in the recorded presentation. And then the mobilizing for the adolescent well-being commitments to date, which is also something that is included in the more detail in the recorded presentation. But here, I just want to share that there is 18 country government commitments, 2 regional, 13 philanthropic and funding organizations, and that includes then 2 NGOs, 1 IGO, and 1 healthcare professional association. The last bullet point here is on the partner engagement, digital advocacy hubs. And I think I really do believe that this is the game changer for PMNCH in really looking at how to enhance our engagement mechanism and strengthen that so that we can really use each other much more effectively. The next slide produces a picture of all of the commitments, be it commitments to action for women, children, and adolescents, which include the COVID call for action, but also the GSA commitments, which are in green. And so this is a really nice picture of what we need to follow up and also have new commitments, which are additional. Our next slide is on campaigns and outreach for action. And what I've done is I've separated, this is for, everything but the adolescent well-being. So this is very much the lives in the balance, is the accountability breakfast, our efforts around WHA, our efforts around UNGA, our efforts in South Africa for the PMNCH conference, and you can see here that our both our registrations, countries, number of countries registered, potential media reach, and social media reach are all on the rise, and so this is really very exciting. It indicates WCAH, MNCH, and SRH. The next slide is an exciting and very typical for our GFA spirit, Global Forum for Adolescent Spirit. And here are some achievements for you. We had 9,000 registrations. At the same time, we had 124 national events, which, as you will recall, was the reason we did this virtual, in order for the energy and efforts to support national events that engage young people, their communities, parliaments, media, governments, multi-sectoral efforts that is taken out in the streets and rallied and demonstrated and really bring a lot of life. And for those of you who attended the GFA, you were witness to a snapshot from all of these different countries and different areas, and bringing it and really doing sustainability of an effort that does not remain in one conference, but it becomes a campaign, it becomes a global movement owned by the people. And so here you have some numbers for this. There is during the event itself, we had 1 anthem, 1 platform, 3 plenaries, 22 sessions, 130 plus speakers, 117 leading partners, 124 national events, and then a lot of art and excitement. You can also see what our reach was. And I've told you the commitments, but our reach is also 2.9 million, and we were able to engage 1.2 million young people to input into the agenda for action, and that was very exciting. And so these are some of the results from the 1.8 campaign, as well as our Global Forum for Adolescents. Let's go to the next slide, which then gives you a snapshot of the knowledge for action and for 2023. Here there has been a lot of efforts to doing scoping, reviews on investing in women and children adolescent health. I would like to share with you that we have provided all this work to the Commission in investing in health, and have asked them to build on it. We've been very busy with the G20 and a lot of wonderful efforts for many of you in this we had a pre-board event in India. Government of India had hosted us, and it had done an excellent session with a lot of young people that were very much the organizers behind this with Government of India. There was a policy brief and also an advocacy brief on prioritizing women, children, adolescent health in the climate crisis. The MNCH, there was a lot of effort around Born Too Soon, the decade of action, and really focusing on preterm and stillbirths and newborn. So this is, and the potential audience reach of this was 3.4 billion. The single largest reach recorded for any PMNCH campaign over the past 3 years. And then we had maternal newborn health key advocacy messages, and it was important for us to message developed by ENAP and EPMM advocacy and accountability working groups with PMNCH and to amplify them. Then we had the high-level champion-led media op-eds, high burden of maternal mortality in the Telegraph by our board chair and Dr. Tedros. And then we had the maternal and newborn health in Africa, produced by His Excellency Ramaphosa as chair of the Network of Global Leaders. Then the SRHR is advocacy brief on SRHR and UHC, why sexual and reproductive health and rights are essential for universal health coverage, used by partners to advocate for SRHR language in the UHC political declaration, but also in national policies and national plans. And we are also, of course, very convinced that this is an important document for our efforts next year for ICPD at 30. So next slide gives us an overview of the very important products that were launched at the Global Forum for Adolescents. And this was an effort that the board really emphasized, that there is too little knowledge known and there's too little consensus around adolescent well-being. And so this is an area that PMNCH needs to step up and step forward and provide. And so we have invested greatly from PMNCH's side, both resources and human manpower. And that's not only the secretary, but among many of you who have played a key role. So there one is the advocacy well-being investment case, and I would just like to share with you, partners, that this is not a one investment case. This is includes also investment case in 2 countries, but it also makes available a global tool and a country tool. And so it is a meaning that the partners can take this and use it themselves. The second here is championing adolescent well-being measurement, and this is GAMA and WHO and partners have been very, UNICEF have been very active in establishing consensus over a monitoring framework, because you know as much as I know that what gets counted counts, because it becomes visible, it becomes procedural, it becomes you put it and may formalize it. So we need a framework, and we need one that there is consensus and gets included in some way in all of the planning at national and subnational level. Then a very proud update from WHO with extensive consultations, I think 8 or 9 regional consultations with the global AHA update to 2.0. And this was also to then encompass and include a lot of the concepts of the adolescent well-being. So that is very important, that when we launch something, we are ready with the guidance material for countries for a greater implementation. And then 4 is the strategy on education for health and well-being, and this is the African Union. And this we have provided inputs and support to. And then 5 is take action for adolescents, which is the agenda for action. Which is every single ask you can click on it and you can get the evidence behind that ask, which is really important way of doing something to create consensus. 6 is unpacking marketing policy to protect children and young people from non-communicable disease, again with the NCD Alliance. And then 7 is evidence to impact, making the case for adolescent sexual and reproductive health. And then 8 is the adolescent, the global adolescent priorities. And this is lights, camera, action from FIA. So these were things that really were amplified and made and launched and at the Global Forum for Adolescents on the 11th and 12th of October. Next slide gives you a snapshot of the accountability for actions, and this is very important. 22-23 highlights included the progress report, and this is the progress report on the global strategy for women, children, and adolescent health, and the potential reach here, protecting the promise, it was called, and it was launched during the World Health Assembly World Health Summit in Berlin last year, and at a potential reach of 860 billion. Capacity building activities in collaboration with partners and the latest country profiles and other data tools to improve progress to women, children, and adult health, including through the UN high-level meeting on UHC and knowledge sharing for the national volunteer reviews organized by DESA. So this is really important, and we do understand that the countdown has a progress report next year, which we would very much like to include efforts on in our work plan for next year. Accountability breakfast. Compendium on women, children, adults, and commitment. You will recall that it was agreed that we should identify already existing commitments that countries have signed under, and then follow up their greater implementation. And so what that has actually then caused is to work with many of you partners who work on some of these commitments and to get an overview in a compendium sort of format over global, regional, and country level commitments and their accountability mechanisms, and in order to empower us all to understand what commitments have made, where are they, what is the status, and what is the mechanism of accountability mechanism around them. The last is the accountability portal, which we were working on to bring together resources that many of you own, and to amplify that more and to make it visible and to make it accessible to partners at large. So this is efforts, and you must remember that we have always agreed on that we should be very accountability focused in order to improve our advocacy. I am running out of time now, so I have to be very quick. Next slide is our governance reform, light touch assessment. There was 2 pieces of work that have been done in order to assess how is the governance reform going. Is it yielding what we wanted? And so light touch assessment was done, and something called good governance and good management, which was much more looking at are we diverse, are we inclusive, are we all of those measures. I just want to share with you that there has been a number of recommendations. This has already gone from the consultants and the task team to the Governance Ethics Committee, and the Governance Ethics Committee has sent it to the Executive Committee for their review and approval. And that has already been done in their July meeting. And so just to share with you some of the results here is that there has been agreement on significant streamlining of governance structures, reduction of our 5 committees and working groups to 4, reduction of temporary structures from above 50 to a ceiling of 30, and then to look at also to reducing number of meetings from 240 meetings to 140, from 240 to 140 meetings, and then also look at ways of enhancing efficiency, both among partners as well as secretariat. And so all of this has been done, and it's well underway, and there is a report that will be made available on the website of all of the recommendations that were made and the status of them. So that's soon to be posted on the website. Here, there was also, as part of the good governance, and I just want to bring your attention to the right, the score that we had among 50 variables was there was 0 in red, and there was 16 in yellow, and there was 34 in green. And the effort here is to keep the greens and move the yellows into the greens. And so these recommendations were set based on also looking at how to do that. I just want to share that our global 50/50 report has not ours, but that's come out with very positive results for ourselves, where PMNCH has ranked very high performer consistently over the 4 years. And then MAIE, PMNCH is a global leader in the MAIE and making explicit checklist recommendations in our operations, including remuneration and young leaders represented in governance structures throughout all of our operations. So here is so a number under the mind work. You will see under point number 2 here that a lot of range of governance related policies are being recommended, though it was agreed not to reinvent the wheel, but to use as much as possible what it already exists at WHO and then customize it for PMNCH. So there is an effort that is ongoing for that. The third is the increasing governance management efficiency. And here there's 2 main recommendations: more clarity on roles and responsibility across management and governance structures, facilitating a stronger partner-led approach, and then fostering a healthy work balance among partners and the Secretariat, including soliciting support from PMNCH partners with reduced number of time-bound structures and reduced number of meetings. So the next slide is how much we have grown in membership, and I think this will explode after the digital advocacy hubs come up and running. So we have, from the start of the strategy, gone from 1,040 to 1,431. So that is an increase of 37.6%. And you can see the membership profile according to constituency in the pie diagram. The next slide is a Secretariat update, and I'm soon very much finished here. That is a little bit about the light touch assessment. Overall findings and conclusions was that partners feel well supported by a highly qualified Secretariat. And then reducing governance structures and meetings can improve productivity, streamline efforts, and reduce workload both for partners and for the Secretariat. The MIND, good governance, good management results. We had a study done with 75% response rate from the Secretariat. And out of the 50 variables, we scored extremely positive with 0 in red, only 9 in yellow, and also then 41 in green. And so here the Secretariat will maintain positive green areas and work on areas of improvement, including more role clarity, more effective organizational communication across teams, greater prioritization to navigate and reduce high workload volume. It's very summarized. We've had 2 staff retreats and to identify more in detail. And I can just tell you that what we have done is increase staffing. We have also established no meeting times so that it give each individual more time to concentrate, and then increase clarity on teams. And we will then try, after the GFA has been now completed, to reduce number of teams into more overriding and overall teams, and following also the merging that is happening at on the governance side. So this is actually what we will then do moving forward. However, the organogram officially, together with WHO, who is our hosting, cannot be done before the new ED is in place. And that, I think, concludes then the presentation on the progress report. And let me just stop there to see if there is any questions. I know we're running out of time, and I just want very much just to show you a little bit 24, 25, but let me stop there and ask you if there is any burning questions here. Okay, I don't see any, so I shall just take that that was a little clear, and so move on to the last two slides, which is the last part of the second agenda for today, and that's looking forward to 24-25. And this is possible priority goals and deliverables for the EC and board review and approval. So just to say that this is something that all of you in one way or another are involved in and can influence either to going to your constituency chair or to your committee chair or working group chair. And so this is what has been actually from the committee and working group or committees, PEC and SAC, being recommended after a couple of meetings. So next slide. So this is the overarching priorities suggested for our 24-25. One is to increase focus on women, children within a PHC, UHC implementation, improving equity and access. And then increase focus on vulnerable and marginal groups, including in conflict and climate regions, climate affected regions, through follow-up of commitments on women, children, adolescent health. The second area is mobilizing commitments for adolescent well-being, guided by the priorities of the Agenda for Action and the 1.8 campaign, and following up on implementation of existing commitments, but also increasing the number of commitments where commitments need to be made. And then especially guided by the AAA, especially focus on the Ask 1. And you will recall there were 7 asks. So Ask 1 is to provide universal education and vocational training. Ask 2 is health and well-being services. And Ask 3 is mental well-being and resilience. Number 3 is to increase focus on ending preventable PMNCH and stillbirths and advance PMNCH strengthened implementation and accountability. And here the suggestion is to really emphasize and provide massive advocacy of the ENA EPMM targets, as well as the child survival targets. 4 is to uphold sexual and reproductive health and rights. And your partners, you will recall that we are entering ICPD at 30 next year. And so this will be support to the Lancet Good Market definition of comprehensive SRHR and strengthening implementation and accountability for SRHR commitment. Next slide. And I shall not go into detail here, but I should just explain this. So you will recognize what I've just read of broad stroke recommendations to be in the left column as goals, and then you will then also see that the other columns follow our functions, our advocacy functions of knowledge, evidence, and partner engagement, and campaigns and outreach. And what has been done here is articulate outputs to key outputs building on 2023-22 efforts, but also opportunities that we know of in 2024, like ICPD, and also women, the resolution, for example, for women, children, adolescents, and so forth. So here, and also the decision or the recommendation, sorry, of PEC, the Partner Engagement in Country Committee, of expanding from 10 to 15 CAP countries, and also following up all of the adolescent well-being commitments and mobilizing for more. So you will see that both it will identify platforms, it is products, and also events. So hopefully when we come out of the board, we will be able to say which events are deep dive and require investment from us, and also which countries, and also which regional platforms. So in order to also strategically envisage at any given time how we can combine powerful evidence with partner engagement networks and platforms, with the events, meetings, and timing, as well as media outreach. So that is what the added value of PMNCH is, to work in that kind of a strategic, orchestrated way. I will stop now. I am over, but that was my last slide. This is being recorded, so you can look at it at your leisure, or you can please feel free to follow up with questions if you have any, either to your chair of your constituency or to your focal point in the secretariat. And that will be something that we will then follow up and provide any kind of guidance. So let me stop there and hear if there is any question. So let me go to Mike Biswell first, and then.
Thanks very much, Helga. This is Mike Ndizo, Chair for the Academic Research and Training Institutions. Not really a question, but a comment in terms of a very good observation I've made, either in the presentation or in the course of implementation, in that there is a very high level focus in terms of influencing policy, but at the same time also capturing sentiments and advocacy needs for the grassroots. And in between, you have the academic research and training institutions. So it's more or less catering for a multi-level approach, where some of the evidence we synthesize coming from the academic research and training institutions kind of takes that why to either inform policy formulation or indeed inform the advocacy required at grassroots level. Thank you very much. I'll mute.
Thank you for that. I think you will see on the work plan that it's not necessarily on the high level, because the CAPs involve civil society, and they may include citizen hearings. They may include parliamentarian hearings, which bring constituencies to politicians, and not only politicians. The other is if we follow the model of the national events that the GFA conducted, that was very much a community. Many of them were in community, but also in academic associations, and also healthcare professionals. So I think it's very much for each constituency to look at how they can best input and influence, input in the work plan. And I think the more we get design that, both in the work plan, but not the least in the results framework. And I do think that academia has a major role in influencing pre-service programs and also in-service programs, as well as activities taking part at the university, engaging young students and so forth. So that I think could be very well built on. I'm going to go on to...
Actually, I'm agreeing with you, Helga. Is that multi-pronged approach which I'm commending,
yes.
You know, that from grassroots right up to the highest level, that entire spectrum. Thank you.
I think that would be very good to make explicit at the board, Mike. So please do that. Dr. Talib, and then
Thank
Dr. Lina.
Thank you, Helga, for opportunity. First of all, I must congratulate the entire leadership, including yourself, of the PMNCH for building this greater network of partnership and platform to advocate for the maternal, neonatal child health and adolescent health. I very much appreciate the priorities, suggested priorities for 24-25. I would just highlight the need to integrate the access to contraception with MNCH. I mean, this should be further emphasized in the wake of FP 2030. I can see in the partnership that there will be uh, emphasis on the partnership with FP 2030, but it would be good to have some explicit mention of how to integrate MNCH with family planning. This is my query. Thank you.
Thank you for that. In fact, we are very explicit about that. We are very explicit not only about the continuum of care, but also a life course approach and the importance of integrating essential services within the PHC. But I think we need to do both, because if we are not explicit, it can be lost. And so another thing is that the retreat showed that Dr. Talib, that if you put it one place, it's kind of very repetitive, but it was implicit and it was said by many, especially academia, research teaching institution members, that we can't talk about SRHR without talking about adolescent well-being. We can't talk about MNH without it being integrated in SRHR and vice versa. So we are absolutely, please help us in making sure that the wording we use is adequately reflective of that. Over to you, Dr. Hina.
Hi, thank you very much for the details that you've provided, comprehensive. A couple of questions. Does the Lancet Commission report, and I understand if you may not have the answer to hand right now, in the health investments, were the low middle income countries prioritized at all? Was any budget allocated for them? And the second question, among the 15 CAP countries included in your list, I wasn't able to see many in the existing 10 or the new 5 from South Asian region, considering we harbor 1/4 of the world's population and a heavy burden of both NCDs and communicable diseases, and including mental health problems. So just wondering any reason why. Thank you.
Yeah, that is a key question. Let me take the last one first. I think that there is a recognition that we can mobilize for commitments from all LMIC countries and beyond, because some of our issues are critical in all countries. And so, and there's benefit for that.
Yes, I wanted to make an appointment for 2 people for Friday.
What we need to do is that the caps are, that has to do with the PMNCH's resources, and not because that there is not need to do in to focus in all countries. So I think we need to see a little bit on our regional platforms and see how we can use them in order to focus on all of the key LMIC countries, Dr. Hina. So I think these 15 can be special efforts, because the maternal mortality or the targets are going not well, but to then see how we can use some of the regional platforms in order to do, to follow up on commitments and to also get new commitments from all of the countries. Your second question, could you repeat that, please? Maybe your first question.
No, that's okay. You mentioned the Lancet Commission
Yes.
report in health investment, and sorry, I haven't had any content from it. So I was wondering if there was any budget allocated for low middle income countries again. Thank
So
you.
it has to do with financing. It has to do with investment, and it has to do with several aspects. So yes, it does flag where investments are needed, and also enters a little bit about different ways of financing, which I think is needed. So the paper will come soon to you, the concept note, and you'll see kind of the angle it's taking. But definitely, I mean, the intent of this is to make known what high investments, as a high return on investments are on not only health but social and economic returns.
Thank you.
Okay, I don't see any other hands, and I shall spy the chat. Yeah, there is no question there, but if there is anything, please feel free, as I said, to your co-chair of your constituency or your focal point at the Secretariat, or directly to me if you want. And then we will then try to facilitate that to the various governance constituencies, so that they know that you have asked the question, or you come with that suggestion so that they can take it. Because remember that you are represented by your constituency chair and board members at the board. So that kind of then concludes this seminar. I hope it has been useful, and we shall then follow up with sending you the recording and also with the PowerPoint, so that you can have that. But lastly, this is going to be my last time with you, and so I would like to thank you from the bottom of my heart for my function as your executive director. As many of you know, I will be starting at UNICEF as of 1st of December as the Director of Health there in New York. We look forward. I will be in the space. You will see me again. We'll just be wearing another hat, and I look forward to also that and collaborating with you from that angle. So thank you so much from me, and see you then soon.